Now we will be discussing the thoracic wall, the various structures that are contributing for the thoracic wall, which includes the intercostal space, which is composed of the muscles that will be contributing for the thoracic wall along with other structures. To understand the importance of thoracic wall, I am here with presenting a clinical case scenario. During extended lockdown of COVID-19, when the wine shops are opened, there is a fight between two individuals with a past history of rivalry between them that resulted in stab injury to one male on the left side of his chest. The patient was brought to the emergency department in a state of shock. On examination, it was found that there is a 1.5 centimeters wide wound in the left fourth intercostal space, approximately 4 centimeters from midline or 3 centimeters from left lateral margin of sternum, with a depth of about 3 centimeters. Dull note on percussion and absence of breath sounds on left side were observed. Massive amount of blood was coming out from the chest tube that was introduced. The procedure planned and performed by the doctor are thoracotomy, incision along the lateral margin of sternum to anterior axillary fold. You should be able to answer the following questions with regard to the clinical case scenario we have discussed. What is thoracotomy? What anatomical knowledge is required for performing the procedure of thoracotomy? Through what structures the surgeon's knife has passed to reach the pleural cavity? What precautions has to be taken while performing this procedure? What is the cause for heavy bleeding? Now let us see the layers of the thoracic wall. In this picture, a small bit is removed from the lateral wall of the thorax. The layers that are seen are the skin, the superficial fascia. If this bit is in the pectoral region, you will come across mammary gland. The next is the deep fascia, which forms a strong fibrous network, and it will be enclosing the muscles in this region. And in the case of pectoral region, the deep fascia is called the pectoral fascia, and there is what is known as clavipectoral fascia towards the clavicle. Internal to the wall, there is the endothoracic fascia, and the same endothoracic fascia towards the apex of the lung. It will be covering the cervical pleura, covering apex of the lung, and that part of endothoracic fascia is called suprapleural membrane. Deeper will be the thoracic skeleton. In the lateral wall of thorax, the skeleton, you will be seeing the ribs, the muscles of the thoracic wall, which are divided into extrinsic and intrinsic muscles. Now let us see what are the extrinsic muscles. The extrinsic muscles are those covering the entire thorax except anterior and posterior midline. They can be divided into muscles of upper limb, muscles of back, muscles of neck and muscles of abdomen. The muscles of upper limb are the pectoralis major and pectoralis minor, the serratus anterior and subclavius. The muscles of back are the trapezius, latissimus dorsi, the levatores scapulae, rhomboideus major and minor, supraspinatus and infraspinatus. Serratus posterior, superior and inferior, teres major and minor. The muscles of upper limb and the muscles of back, except for serratus posterior, superior and inferior, all the others were seen by you during your dissection of the upper limb. The serratus posterior, superior and inferior will be seen during the thorax dissection. The muscles of neck are the scalene muscles. There are 3 scalene muscles. They are the scalenus anterior, scalenus medius and scalenus posterior, which you will see them during your head and neck dissection. Muscles of abdomen. The muscles of the abdomen that will be extending towards the thorax are the rectus abdominis and external oblique muscle of the abdomen. Now let us see what are the intrinsic muscles. They can be divided into those of intercostal space and others. The muscles that are arranged in the form of 3 layers in the intercostal space are external intercostal muscle, internal intercostal muscle and innermost intercostal muscle. In this picture, you can see the skin, the superficial fascia and the extrinsic muscles in that region, that is the serratus anterior muscle you are seeing because it is from the lateral chest wall. Now focus on the intrinsic muscles in the intercostal space. These are arranged in 3 layers. Outer external intercostal muscle you are seeing. Observe the direction of the fibers that are running downwards, forwards and medially. Then the middle internal intercostal muscle. Observe the direction of the fibers. They are running backwards, downwards and laterally. So opposite to the direction of the internal intercostal muscle. Then the innermost intercostal muscle. This muscle has 3 parts. They are the intercostalis intimus, subcostalis and transversus thoracis. In between the internal intercostal and innermost intercostal will be the neurovascular plane, where the intercostal vein, artery and nerve are seen from above downwards, and they are placed in the costal groove on the internal aspect of the rib. Then next to it you will be seeing the endothoracic fascia with the pleura, that is the parietal pleura. This is the endothoracic fascia, this yellow one. Then you are seeing the parietal layer of pleura, then the pleural cavity, and then the visceral pleura in contact with the lung. So the intrinsic muscles you have seen are the external intercostal, internal intercostal, and innermost intercostal. The other muscles that come under the intrinsic muscles are the Levatores costarum and Serratus Posterior, which will be seen in relation with the posterior thoracic wall. Now let us focus on intercostal spaces. So the intercostal space is located between two ribs. There are 12 ribs on each side. So there are 11 intercostal spaces on each side. Anteriorly, there are only 9 spaces. The other spaces are not extending anteriorly because the lower ribs are the floating ribs. The extent of the intercostal space, it extends posteriorly up to costotransverse ligament and anteriorly up to the sternum. So starting from lateral margin of sternum to costotransverse ligament, that is the extent of the intercostal space. The intercostal spaces can be classified into typical and atypical spaces. The 3rd to 6th spaces are typical spaces, as the neurovascular supply in these spaces is confined to thorax. The others are atypical spaces. For example, 1st, 2nd, 7th to 11th are atypical spaces, as the neurovascular supply extends to the neck and to the upper limb in the 1st and 2nd spaces and to the abdomen in the 7th to 11th spaces. Now, let us look into the details of typical intercostal space. The typical intercostal space, as mentioned before, it can be defined as the spaces between the two adjacent typical true ribs with costal cartilages and contains vessels and nerves that are confined to the thoracic wall. The typical intercostal spaces are 3rd to 6th. In this picture, you can see the intercostal space between the two ribs and their costal cartilages. And you can also see the contents of the intercostal space, that is the vein, artery and nerve, and the collateral branches from the vessels and the nerve. In this picture, you can observe the two ribs and between them the intercostal space containing the external and internal intercostal muscles and the innermost intercostal muscle with the neurovascular plane in between the internal intercostal and innermost intercostal muscle. Boundaries of typical intercostal space. Typical intercostal space is bounded above by the lower border of upper rib with costal cartilage. This is the anterior rib you are seeing towards the sternum. And below is the upper border of lower rib with costal cartilage. Then anteriorly, the lateral margin of the body of sternum between adjacent costal facets. Posteriorly, it is bound by the lateral surface of body of thoracic vertebra. So, the intercostal space is the space between the lower border of upper rib with costal cartilage and upper border of lower rib with costal cartilage, and it extends anteriorly up to the lateral margin of body of sternum between the adjacent costal facets, and posteriorly it extends up to the lateral surface of body of thoracic vertebra. The contents of the intercostal space are the three intercostal muscles, the external, internal and innermost intercostals, intercostal nerve, intercostal arteries, intercostal veins, intercostal lymph vessels and nodes. There are 11 sets of intercostal muscles. From superficial to deep, they are the external intercostal, internal intercostal and innermost intercostal. The innermost intercostal is deficient in upper spaces. The intercostal muscles are supplied by corresponding intercostal nerves. The action of these intercostal muscles is to pull the ribs nearer to each other and to strengthen the tissue in the intercostal space. Regarding the external intercostal muscle, these external intercostal muscles are superficial. The most superficial muscle in the intercostal space is the external intercostal. If you observe in this picture, you can see the external intercostal muscles in the typical spaces. The direction of these fibers are downwards, forwards and medially. Like you insert your hand into the pocket of your pant. So that will be the direction of the external intercostal muscle. So the direction is downwards, forwards and medially. The origin of this muscle is from the sharp lower border of the rib above, that is the origin, and insertion is into the outer lip of the upper border of the rib below. So if you see the upper border of a rib, it will have two lips, an outer margin or outer lip and an inner margin or an inner lip, and this muscle is inserted into the outer margin or lip. What is the extent of the intercostal muscle? In this picture, you can see the pectoral muscle, that is the pectoralis minor muscle, and follow the intercostal spaces. Though you are seeing the parts of the serratus anterior muscle in the lateral wall of the thorax. These external intercostal muscles, they are directed downwards, forwards and medially, and the extent of these muscles is posteriorly the tubercle of the rib and anteriorly it will be at the costochondral junction, where it becomes the external intercostal membrane or anterior intercostal membrane between the costal cartilages. So this is the anterior or external intercostal membrane starting from the costochondral junction to the lateral margin of the body of the sternum. The nerve supply of external intercostal muscle is the intercostal nerve of the space. The action of external intercostal muscles or elevation of the ribs during inspiration. So, the action of external intercostal muscle is elevation of the ribs in inspiration. Then let us see the internal intercostal muscle. So this is the intermediate layer. In this space you can see the external intercostal muscle is removed. And what you are seeing is the internal intercostal muscle. And what is the direction of these fibers? The direction of these fibers they are directed downwards, backwards and laterally. Downwards, backwards and laterally. And what is their origin? So they are originating from the floor of the costal groove, or you call it as the subcostal groove of the rib above, and inserted into the upper border of the rib below. So the upper border of rib, as I told you, contains the outer margin or rib and inner margin or rib. So the intercostal muscle, internal intercostal muscle is getting inserted into the inner margin of the upper border of the rib below. And what is the extent of the internal intercostal muscle? See, this is the internal intercostal muscle which is directed downwards, backwards and laterally. So this is the external intercostal muscle. And the internal intercostal muscle is extending from the sternum in front to the angle of the rib behind. So it extends from the lateral border of sternum to the angle of the rib. And beyond that angle of the rib, posteriorly it is deficient and is replaced by internal intercostal membrane or posterior intercostal membrane. So between the costal cartilages, anteriorly is the anterior or external intercostal membrane, which is an extension of external intercostal muscle. Posteriorly, beyond the angle of the rib, you will be seeing the posterior intercostal membrane or internal intercostal membrane. The nerve supply is intercostal nerve of the space. The action of internal intercostal muscle is elevation of rib in expiration. The external intercostal is elevation in inspiration. The internal intercostal is elevation in expiration. Coming to the innermost intercostal muscle, it is the deepest layer and it's an incomplete layer, and it is subdivided into three parts. They are the intercostalis intimus, subcostalis muscle, transversus thoracis or sternocostal muscle. In this picture, you can see the direction of the external intercostal muscle as if the hands are in the pocket, and see the direction of the internal intercostal muscle as if the hands are on the chest, and see the innermost intercostal muscle which also follows the same direction as the internal intercostal muscle, that is hands on chest. Here you are seeing the transversus thoracis or sternocostal muscle. The three strips you are seeing on each side. Here one more strip additional you are seeing, and these are the internal thoracic vessels. Here, see, this is the lateral view of the thoracic wall, wherein you can see the external intercostal and the internal intercostal muscles and the costal cartilages. All these muscles are supplied by the intercostal nerves and arteries and are drained by the intercostal veins. In this table, the details of the three components of innermost intercostal muscle are simplified. Let us go through each of those components. The intercostalis intimus muscle originates from the ridge above the costal groove on the inner surface of the rib above, and it gets inserted onto the inner surface of the rib below. As all of you know that the upper border of the rib gives insertion to the external intercostal muscle, followed by internal intercostal muscle, and then deeper to it towards the inner surface of rib will be the insertion of the intercostalis intimus. The extent of innermost intercostal muscle, the component of intercostalis intimus insertion, is confined to the middle 2/4 of the intercostal space. The direction and action of the intercostalis intimus is same that of the internal intercostal muscle. The subcostalis originates from the inner surface of the rib nearer the angle, and for its insertion it crosses 2 or 3 ribs and it gets inserted onto the inner surface of second or third rib below. Its extent is confined to the posterior parts of lower spaces. The direction of fibers is same as that of the internal intercostal and intercostalis intimus, but its action differs. It is a depressor of ribs. The transversus thoracis or sternocostalis, it arises from the posterior surfaces of the sternum, xiphoid process and costal cartilages of 4th to 7th ribs. So it arises from the lower 1/3 of posterior surface of body of sternum, posterior surface of xiphoid process, posterior surface of costal cartilages of 4th to 7th ribs, and it gets inserted into the 2nd to 6th costal cartilages, and its extent is behind the sternum and costal cartilages. Its direction is upwards and laterally. Its action is it draws the 2nd to 6th costal cartilages downwards. In this picture, you can observe the transversus thoracis muscle going towards the costal cartilages of 2nd to 6th ribs. This is the one, and you can see the other muscles, the innermost intercostal muscle, the internal intercostal muscle. You can also see the structures that are running in the intercostal space. From above downwards, in each space you are seeing the vein, artery and nerve, and you can also see the internal thoracic artery coming downwards, which divides into the musculophrenic artery and the superior epigastric artery. The internal thoracic artery, the vein are concerned in the supply of the intercostal spaces. So this is the transversus thoracis muscle which you are seeing in this dissection, and you can identify the other muscles, the internal intercostal and innermost intercostal muscles. And this picture is shown to understand what is the angle of the rib and what is the costochondral junction, which you should remember in relation with the extent of the external and internal intercostal muscles. See, from the costochondral junction to the lateral border of sternum, the external intercostal muscle is replaced by external intercostal membrane. And similarly, behind, posterior to the angles of the ribs, there is the posterior intercostal membrane, which is the continuation of the internal intercostal muscle. Now you can again see the positioning of the external intercostal muscle, the internal intercostal muscle, the innermost intercostal muscle, and the vein, artery and nerve in the neurovascular plane between the internal intercostal and innermost intercostal muscles. Here you can revise the direction of the muscle fibers. The external intercostal muscle, which is directed downwards, forwards, medially. The internal intercostal and innermost intercostal, they are seen running downwards, backwards and laterally. Now you have studied the external, internal and innermost intercostal muscles. There are what are known as the Levatores costarum and Serratus posterior group of muscles on the posterior wall of the thorax. And what is this Levatores costarum? There are 12 pairs of muscle strips you will be seeing on the back of the thorax, lateral to the vertebral column. These are the vertebral spines. Lateral to them, you are seeing these are the transverse processes. So they are originating from the tips of transverse processes of T7 to T11 vertebra. Then what is their insertion? So the upper edge and outer surface of the rib, immediately below it, in the interval between the tubercle and angle, they are getting inserted. The lower 3 or 4 are together called the Levatores costarum longi because of their long slips. Their direction is downwards and laterally, and they are supplied by the dorsal rami, the lateral branches of the dorsal rami of thoracic spinal nerves. Their action is elevation and forward rotation of neck of rib. And they also produce rotation and lateral flexion of vertebral column. So elevation and forward rotation of neck of rib and rotation and lateral flexion of vertebral column are the functions of Levatores costarum. Coming to the serratus posterior, there are two muscles in this: serratus posterior superior and serratus posterior inferior. If you observe here, this is the serratus posterior superior and this is the serratus posterior inferior. The serratus posterior superior, it originates from the spinous processes and supraspinous ligaments of C7 to T2 vertebra. And their insertion is onto the posterior aspects of the ribs 2nd to 5th. Their nerve supply is anterior primary rami of T2 to T5 nerves. Their action is they assist forced inspiration. That is the serratus posterior superior. Coming to the serratus posterior inferior, it also originates from the spinous processes and supraspinous ligaments of T11 to L2 vertebral spines. Their insertion is onto the posterior aspects of ribs 9, 10, 11, 12. 9 to 12 ribs on their posterior aspect. The nerve supply is the anterior primary rami of T9 to T12. And its action is they assist in forced expiration. Coming to the endothoracic fascia. It's an extrapleural fascia that lines the wall of the chest. It is located between the muscles and bones of thoracic wall on one side and the parietal pleura on the other side. This is the pleura, and you can see the thoracic wall, muscles and bones. Then it extends over the apex of the lung or the apical pleura, which is known as the cervical pleura, where it is called the suprapleural membrane. Here it is called the suprapleural membrane. And it forms a thin layer between the diaphragm and pleura below. So above it is the suprapleural membrane, and below it forms a thin layer between diaphragm and pleura. So now we have seen the wall of the thorax. So especially in relation with the intercostal space from superficial to deep, the skin, the superficial fascia, the deep fascia, the external intercostal, internal intercostal, innermost intercostal, then endothoracic fascia. Next to this endothoracic fascia will be the parietal pleura, followed by pleural cavity and visceral pleura and the lung. So this is what you have seen here. So the external intercostal, internal intercostal, the innermost intercostal, between the middle and deep layer, the vein, artery and nerve of that space. Then you will be seeing the endothoracic fascia, the parietal pleura, the cavity, the visceral pleura and the lung. What about the neurovascular bundle in the intercostal space? It lies between the internal intercostal and innermost intercostal. It runs high in the intercostal space and it is related to the costal groove or subcostal groove of the rib above. And the order of arrangement from above downwards is the vein, artery and nerve. As the innermost intercostal muscle is not forming a complete layer, which was having 3 components, and only in the middle 2/4 of it, you will see the intercostalis intimus, and then the subcostal is, and then the transversus thoracis. They are incomplete muscles. Because of that, the bundle, the neurovascular bundle, is generally covered on the inner side by the endothoracic fascia. So now you have learned what is the intercostal space, the boundaries and the contents. We have learnt it. Now we will go into the details of each of the contents in the next lecture.